How has the law changed? The law has changed the way we think about insurance. The law requires that people no longer will be exempted on the basis of a pre-existing condition. The law aims towards making insurance more affordable, and it also aims at making the delivery of health care more quality-based, which is to say that the outcomes are what will produce the payment for the physicians and the healthcare professionals. This law changes the way most of us will access and use healthcare services. As we look into the future, there are a number of changes because you can't change the healthcare system overnight. In 2010, children were no longer allowed to be exempt on the basis of a pre-existing condition, and adults up to the age of 26 could stay on their parents' insurance or apply to be readmitted onto their parents' insurance. And there were no longer lifetime maximums for health care. Most people don't know this, but their insurance has or could have had a maximum at which they ran out of coverage when they met that amount. In 2011, all seniors should be able to go to their primary care physician and get a preventive care plan, which allows for care coordination. That is, to get doctors talking to each other with the intent of producing better outcomes. Possibly the most important thing that starts in 2011 is the medical loss ratio. And that says all insurance companies must spend between 80 and 85% of all the money they take in on actual healthcare services. This is a way of bringing down the cost of insurance by requiring that money be spent not on administration, but on health and health care. The most important year, however, is 2014. 2014 is the year that the exchanges, or those marketplaces that people can use to purchase insurance, will be up and running. So all individuals and companies up to 100 employees will be able to purchase their insurance at an exchange that will most likely drive the cost of insurance down. The other thing in 2014 is the individual mandate. All Americans, with a few exceptions, will have to have qualifying medical health care or health care coverage. Also, the no spending limits and the no exemptions on the basis of pre-existing conditions for all insurance plans starts in 2014. This law was passed and began implementation in 2010, but will extend implementation till 2018. So it isn't just this year and next year, it's between 2010 and 2018 that it's fully implemented.